You don't get one chance to walk again. You get thousands. But what if the first step was the most important of your life? If you're navigating hip pain or considering surgery, what you do next could change everything. I'm Dr. Tyler Goldberg, an orthopedic surgeon specializing in concierge hip and knee replacement. For the last 25 years and 12,000 surgeries, I've seen patients literally transform physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. Who gets hip arthritis? This is a great question because there are actually many different types of hip arthritis. The most common is just good old run-of-the-mill osteoarthritis. It's what happens to us as we age and the cartilage in our joints wears out. The cartilage goes away, the joint collapses, and bone spurs are created. The end result of this being pain during routine activities, pain at night that prevents or wakes you from sleep, and stiffness that most people recognize as an inability to put their shoes and socks on. Your activities begin to decrease as the pain increases. There are other types of arthritis, such as rheumatoid arthritis, post-traumatic arthritis, and deformities from injury or birth. Theoretically, we will all get arthritis of our hips if we live long enough, as it is a deteriorating condition that potentially can affect all of us. Your hip is a ball and socket joint made up of the femoral head and acetabulum. When arthritis or injury wears that joint down, even simple movements can feel impossible. What happens in a hip replacement? In a total hip replacement, I remove the damaged femoral head and socket called an acetabulum. Once the bone is repaired, I insert a precision-designed prosthetic cup and femoral stem. With the surgeon's right technique and the patient's healing, the joint becomes stable, smooth, and functional again. More importantly, pain-free. If you're watching this and wondering if you're a candidate, we built a 2-minute quiz to help you find out. You can find the link below to the joint quiz in the description below. I use the Amus technique for anterior approach hip replacement. There are many different variations of DAA, or direct anterior hip replacement. I've chosen a more European style of surgery. The European style of surgery is a dissection-first philosophy. A hip replacement is largely thought of as a dissection of the soft tissue of the hip. At the end, the surgeon will run the saw, the reamers, and hammer the implants into the bone. Contrast that to the American surgery philosophy, where the soft tissue is really thought of as an impediment between the skin and the bone. It's meant to be retracted so the surgeon can get to the fun stuff, sawing, hammering, and slamming implants in. The Amus technique allows me to avoid cutting key muscles, which reduces downtime and speeds recovery. There's an old surgical adage that says you can do whatever you want to do to bone as long as you respect the soft tissue. Amus is the epitome of that adage. Amus, by the way, means friend in French. It's part of why my patients walk within hours, not days. It's part of the reason I don't even prescribe narcotic pain pills after hip replacements anymore. Less muscle damage, less trauma, less pain equals faster recovery, fewer pain pills, quicker return to life. How about technology in my hip replacements? Many surgeons, including me, use some sort of preoperative planning technology to make sure they get the most accurate surgical reconstruction for you. Most technologies use a CT scan for the planning. However, some surgeons will just use a simple x-ray for their planning. They all work, and it's a function of the surgeon's experience and comfort as to whether or not they will use planning software. And by the way, the robot that you often hear about is merely an instrument to help install the hip in an accurate way. The true benefit of the robot is not actually the robot, in my opinion. It's actually the preoperative planning and software that accompanies the robot so the surgeon can perform the hip in the most accurate way possible. Most patients think they'll be down for weeks. The truth? With the right approach, you can regain mobility fast, especially in our concierge setting where nutrition, rehab, and accommodations are tailored to you. I don't want to minimize or underestimate what you're up against. This is still a major surgery and still requires a major recovery. As with any surgery, there are risks both during and after surgery. One of the keys to successful surgery is avoiding the risk. I have a saying that I use with my patients all the time, and I say, no pain, no brain. While we as humans want to avoid pain, and in fact we'll even have surgery to be out of pain, pain can be a good thing in that it will limit or slow us down sometimes. If we don't have pain after surgery, we think we can do more than we actually can do and go faster than our body is ready to do. Sometimes that can result in injury. That is why it's important to slow down and allow the body the time to recover. And then the body will be good for you for the rest of your life. So what is the new recovery mechanism? For me, I'm still a little bit of a traditionalist because I honor the body's healing mechanism, which can be altered but not truly rushed. Therefore, I ask my patients to stay on walkers for 2 weeks for their own safety. Many cheat, and that's okay, But for me, I'd like to see patients go slower initially so that they can go faster later. The initial healing phase of surgery is about 6 weeks, so I want my patients to go slow for that 6 weeks. Then after that, I'll let them progress to activities they want to do as tolerated. For patients that plan to run or do high impact activity after their hip, I want those patients to wait at least 3 months. Truth be told, the entire healing process takes a full year after surgery. That's biology and how we're built as human beings. What do you need after a hip replacement? This is a great question because it could be answered in so many different ways. The obvious one would be items of durable medical equipment, or DME. At minimum, you'll need a walker for a few weeks after surgery. A cane is helpful after that. How long you'll need it is dependent and variable upon you. I've seen patients use a cane for literally 2 hours before getting rid of it, and I've seen other patients hold on to it for several weeks. There are also other items that can aid your recovery, such as cooling pads, anti-swelling stockings, and portable leg compression sleeves to limit blood clot risk, and other various tools of the trade. There are also nutritional supplements and medications that you will need after surgery. I recommend that patients do perioperative nutrition to help support their body's increased metabolic load that occurs after surgery. I also recommend to use a non-narcotic alternative supplement such as CBD, so those patients don't have to face narcotic use to control their discomfort that they may have. Finally, you'll need some sort of medication to decrease the risk of blood clot after surgery. Unfortunately, blood clots can occur after any major lower extremity surgery or trauma, and a hip replacement is just a surgically induced trauma. The most common medication we use is aspirin. However, the biggest thing you will need after a hip replacement, and the number one determinant of your outcome, is a positive attitude. It is well documented that patients with a positive outlook will do significantly better after surgery. I'm sure you want me to bottom line this for you. If my wife were having a hip replacement, what would I recommend for her? The answer is not what you are expecting. If my wife were having a hip replacement, I would pick her surgeon wisely and then comply with their perioperative protocol. I would expect to have some sort of variation of perioperative nutrition supplementation, outpatient surgery, limited mobility with a walker for at least 2 weeks after surgery, and then a gradual return to activities after about 6 weeks. If you're facing hip pain, you have options. The path forward doesn't have to involve hospitals, long wait times, or guesswork. At AOI, and using the TDG Concierge pathway, we give you the outcome you deserve. If you're considering surgery and want clarity, subscribe to this channel. You'll get guidance, honest answers, and a direct look at the TDG Concierge experience. Hit that subscribe button to stay in control of your care. We'll see you next week with more answers, more insight, and more options to your joint health.